Okay, hello everyone, and welcome to this hangout for the data science in medicine, in precision medicine and stratified healthcare MOOC. My name is Areti Manataki.
I'm Gregor Stiglic.
I'm Ming Hong.
And we're really excited to be having this live session with you. So the purpose of these hangouts is to just get together and discuss things around the course, strictly related with the course, but also go beyond what we've learned in the course and find out about what's new in this area, what kind of work people are doing, and so forth. So today we're very, very fortunate to have a special guest with us, Gregor Stiglic. Thank you, Gregor. So Gregor is an associate professor in the University of Maribor in Slovenia. Is that right?
Yes.
Uh-huh. And could you tell us a little bit about yourself?
Yeah. So thank you for having me.
Mm-hmm.
I'm glad that I could be your guest here. I'm an associate professor at University of Maribor in Slovenia. My background is in computer science, and later I also worked in the industry, in the software industry as a software developer for a few years, and then I moved back to academia, where from the computer science faculty I moved to healthcare science, and for the last 15 years I've been working on application of data science techniques in different fields of healthcare.
Excellent, amazing. So your profile fits perfectly what we're covering in this course. Very good. So what kind of projects and what kind of research questions are you interested in your work?
So widely speaking, I'm interested, as I said, in application of data science techniques in different fields of healthcare. More specifically, we're recently working a lot on interpretability, on explainability of machine learning models that are widely used in all fields, but we are particularly interested in those used in healthcare because we all know that interpretability of the models is very important in this field.
And so I suppose you use machine learning and other AI methods to solve healthcare problems, right?
Mm-hmm.
So you mentioned interpretability. What is interpretability and why is it important?
Yeah, as I mentioned, interpretability is there for a long time in machine learning, but recently with the new novel deep learning methods, it became even more important, even more spoken about. In general, we could classify it in two groups. So we have local interpretability and we have global interpretability of the models.
Mm-hmm.
So local interpretability would fit very well with precision medicine, actually,
okay.
Because we are speaking about how specific variables influence the outcome on the level of the specific patient, for example.
Mm-hmm.
While global interpretability means that we are trying to interpret, we're trying to show how the models work, why the decisions are taken on the level of the model, of the general level
mm-hmm.
of the model.
So, for example, if someone built a prediction model, a tool that did classification, so perhaps the decision was at risk for breast cancer or very low or no risk for breast cancer, what would the interpretability, the local interpretability, help do? So would we get extra information?
Yeah. Local interpretability would be very useful for a clinician, for healthcare actors who is working directly with a specific patient.
Right.
And for this patient, maybe it's some blood measurement is more important for the outcome or more related to the risk than in other patients.
Mm-hmm.
This is especially problematic in some groups of smaller groups of patients
yes.
that are not so well represented in a global model.
I see.
So that's why we focus on these groups in this local interpretation.
And I suppose research in this area tries to come up with meaningful explanations for the doctor or the nurse or the clinician.
Yeah.
I wonder whether there's variation in terms of what might be meaningful or useful or easy to follow for a domain expert. Is that something that you've looked at or that people are looking at in this area?
Yes, there is certainly different kinds of how we can present the risk, or how we can present the interpretability, the rules that were used by a model to reach some conclusions, some decisions. For example, when working with the patients, we are always faced with different types, different kinds of patients. So some of them would be more literate, would have more knowledge. We could provide them with more details about some decisions. While for others, we need more general explanation.
I see.
So sometimes this is just a very simple visual representation. Yes. In some cases, this can be very complex rules that people will understand.
So I suppose some social science expertise would be needed when building such explainable or interpretable systems.
Yeah, there are studies that relate directly how the patient perceives some information and what is the level of their literacy and relation to the complexity of the interpretability that we can show to them.
I see, that's fascinating. Perhaps one day we can have a hangout just looking at interpretability, to be honest. It sounds like a very, very interesting topic. Now, earlier today we were chatting with Gregor and he told me about a project that I thought would be of interest to many of our learners. And it was about a decision support system around diabetes screening. Is that, have I understood correctly?
Yeah.
Yeah. Would you like to tell us a little bit about it?
Yeah, recently me and my group are working a lot on so-called digitalization of the screening tests for diabetes.
Yes. Perhaps worth also explaining to our non-clinician learners. So what does screening mean for diabetes, for instance?
Yeah. Well, in Slovenia we have preventive clinics. So those are the clinics where the healthy population will come in and they would be asked a certain set of questions by a nurse, by a qualified nurse. And based on those questions, they are then stratified into some risk groups. And based on that, they can be referred further to change a lifestyle or do some exercise or something like that. So to prevent as early as possible the complications of the onset of diabetes. So we're trying to improve the models that are in use now and have been developed 30 years ago, maybe. And most of those models are even developed on the population that's completely different than what those healthcare experts are working with on the daily level. So, and we are trying to collect data from electronic health records, then build prediction models, either very simple regression models or even machine learning models as well, where we use the aforementioned interpretability techniques as well to provide the healthcare experts some output that is not just a number that represents a risk, but also, as I mentioned before, maybe some rules, maybe some visual representation. So what and how the risk for this specific patient will look like in 10 years or something like that. And how the change of the lifestyle influences then this risk. And this is also important.
I see, very good.
Show to the patient.
And you mentioned machine learning methods. So actually, machine learning is one of the topics that we look at in this course. So would you like to mention what kinds of methods? So it's not like we've covered everything in lots of detail, but I think it would be of interest to our learners to hear more about it.
Yeah, so I've been working in machine learning for more than 20 years now, I think. So I've seen a lot of hype around different kinds of methods. So, but we still use quite basic methods, I would say, like random forests, like boosted decision trees. Even in some cases for the sake of interpretation, because they're very simple, maybe even a few decision trees or just a few rules that can really represent the important part of the classification.
And the model that you're building essentially aims to either replace or improve the existing questionnaire set of questions. Is that right?
Yes, we're also putting a lot of emphasis on reducing the number of questions that are asked, because originally the nurse has to go through around 70 or even more questions with the patient.
Yes.
So it makes sense if we
Yes.
can reduce this number to 10 questions and still get the same performance in prediction.
That's a very, very good idea. Yes, yeah. So suppose when it comes to this particular tool and the project, there needs to be some expertise in machine learning, some medical expertise, I suppose. So it sounds like a very interdisciplinary project. So I'm wondering what kind of skills, what kinds of expertise do the people in your team had working on this?
Yeah, as I mentioned before, my background is computer science, but as I work at the Faculty of Health Sciences at the moment, I'm working with a lot of different people, different researchers from different fields. But in this case, this project is interesting because we actually put something that was developed, so those prediction models, in practice, so it's in clinical practice. So in this case, you are meeting even more different profiles, different experts when working in the field, right? So we are mostly working with nurses, with doctors, with also with software developers who are then on one side collecting the data, and on the other side they are implementing the final solution that can go in clinical practice, because the prototypes we built in the research environment are not directly transferred.
Of course, yeah. So I have to say, the projects that you're describing, so the idea of having it deployed in clinical practice is every health informatics researcher's dream. It doesn't always happen. It tends to take quite a bit of time in my experience, but it must have been very fulfilling to have it in healthcare practice there, helping healthcare professionals and patients, right?
Yeah, it's always a pleasure to have it there. And it's a lot of challenges you have to go through before you can come that far, right? So it begins with the collection of the data, where there is a problem how to access data. You have to solve all those legal issues. You have to solve all those ethical issues around this. Then once we had the data, we found out that there is a lot of clinics that are where the amount of missing data is really large. While on the other hand, there are clinics that really have had all the data in the system. So there is also this aspect. So we tried to educate nurses to show them why this is important to collect the data, to enter the data actually into the system. We even wrote a paper on this. So how much we are losing because we are not entering the data into systems.
So from my experience in working with clinicians and health professionals in general in the UK, there's a lot of fatigue around reporting and documentation. So I could imagine that this could be part of it, because they have to fill in so many forms. They think, I'm not going to do this as well. So was that your experience?
It's the same, It's the same in Slovenia, and as I mentioned, but there were some clinical centers where the amount of missing data was less than 10%. On the other side, we had some of them that had more than 90% of data missing. So if some of them can do it, probably others can do it as well.
True. So you mentioned legal challenges or ethics challenges with respect to convincing healthcare professionals to actually do the documentation needed. Were there any other challenges in this project at any stage? So even on the technical side, on the cultural side, on the translational side? I don't know. Is there anything else that you would like to share?
We actually, in the end, built two models. So one model was targeted at the healthcare experts. It offered a lot more details, but we also offered a model that can be used by lay population, so anyone can use it. And in this case, you have to provide the model that is simpler, the user interface that is simpler. And we are still working on this. So how to provide the user interface that is more suitable for healthcare experts on one side, and on the other side, maybe that it can be used directly by patients.
Okay, very, very interesting. Yes, yeah. In terms of lessons learned through this project, because it sounds like a very rich project, different types of expertise, different challenges. So is there anything that you would like to share with our learners? Perhaps if you were to do a similar piece of work, would you do anything differently?
Yeah, we learned a lot.
Yes.
in this project. Yeah, as I mentioned, I think if someone is working in this field, a lot of time you have to be persistent to succeed, right?
Okay.
As I mentioned from the beginning, from this step where we saw that there would be a possibility to provide a solution that would be much more effective than what is in use at the moment. Through the, as I mentioned, collection of the data, we had to be persistent. We had to always meet some people, push some people to get the data, for example, in the beginning. And then it was the same. Once we had the product, we had to convince the software developer company that it's worth investing in this, right? And deploying the system in practice. And once it's in practice, then the healthcare experts will ask you, why do we need this?
Of
what
course.
will we get from this? But, so yeah, all the time you have to be persistent to get it to clinical practice.
There are some people doing health informatics research that argue for a participatory approach in terms of including your end user, whoever that might be, so including those health professionals or those patients early on in the process. So their perspective is covered too, and perhaps afterwards they'll act as ambassadors for your idea. So push it to their colleagues. Is that something that you've seen from this or other projects?
Yeah. Well, even our project is not completely finished yet.
Yes.
So even if we have it in clinical practice, we are currently working on a bit larger project with the University of Leuven from Belgium, with a group of in human-computer interaction, and there we are trying to develop novel approaches of how to present the data to the users.
Yes.
And in this case, it's very important to have this participatory approach.
Yes.
So we are planning a visit for the experts from Belgium to come over to Slovenia and talk directly to nurses and to patients who use this system.
Very good, very interesting. I was also, so now that you were mentioning the different countries where your collaborators are based, I was thinking, so you're normally based in Slovenia, right? And I was wondering if there's anything, so is there something like the NHS, the equivalent of the NHS in the UK in Slovenia? That's my first question. And the second one is there a lot of interest in using data in healthcare?
Well, mainly the initiative of the, we call it e-health in Slovenia, is led directly by the ministry, also by the National Institute of Public Health, which is something similar to the NHS in here in the UK. But I would say that you are much more advanced here in terms of collecting the data. We are much behind here. We just started collecting data in a structured way for primary healthcare level, while here you can get the data for the more than 20 years in this respect. So some models that are similar to what we have been developing on a sample of 3,000 to 4,000 people have been developed here at NHS data with 3 or 4 million people.
Yeah, thank you for
okay.
And
Thank you.
Thank you for Gregor. And because RIC has a code. And first of all, about the course, I'd like to went through some questions from discussion forum. And as we can see from discussion forum, and we are very happy to see like more and more people, we show up to help each other and to answer each other's questions. And also we noticed about there's a question about like unable to connect to Jupyter Notebook server. And I'd like to say that it happens sometimes that the server will be collapsed for a while, a short period of time. It happened before, and so we tested here and it works fine now. It should be okay now. So if there are more learners, you still have these problems, like you can't connect with Jupyter Notebook server, please let us know. Just shout in the discussion forum, and we will contact with Coursera to solve these problems. And also, there is a question about read CSV file, and we just want to say that the path we showed in the videos in the lectures is out of date now, so it doesn't work. And so if you want to import the CSV file, that's for Python basic video too. Yeah, so for Python basic, the code, you want to import the CSV file, please use the code we showed on our notebook script instead of the path from the video. And also I noticed that many thanks for Pauline Billington, if I pronounce it right. Many thanks for Paul to share, for example, share data set for us to have a look, and also sharing the code that do some job. And we also encourage more and more people to share ideas or like share more resources if you have on discussion forum. And we also noticed that there are a lot of topics on the discussion forum that ask for the peer review of their assignments. And according to the rule, we have to do more than, each learner have to review more than 3 assignments, but we do encourage that if you can do more, it would be better. And also because you choose 2 topics from the list of the topics for assignments, if you do more reviewing, you might have more ideas about other topics you didn't choose, and like more idea of the combining different topics, and also more examples from the other learners on the discussion forum. Yeah, that's basically everything I want to talk about from discussion forum.
Okay, very good. Thank you, Michael. Just to say, I'm losing my voice, so I hope I can keep going. So finally, first of all, thank you, Gregor. And thank you, Minho, for the update. I thought I'd give people an update on some health data science news in general. So there was a conference in Edinburgh in September. Oh, this is actually quite tough. Called Doing Data Right. And the idea is that it's not just about technical work, but also working with people and partnerships to drive data-related innovation. So there were people from business, from academia, from charities, the business sector, and speakers from lots of different organizations. So including the Open Knowledge Foundation, UNICEF, Accenture, and others. And I thought I'd mention one of the keynote talks that I thought were really fascinating. So that was Caroline Criado Perez, who's the author of the book called Invisible Women, Exposing Data Bias in a World Designed for Men. So she talked about the gender data gap. So basically, the story she told us is the following. The data that our society collects is mainly about men's experiences, not women's. And then that data is used to design products, services, spaces, and so forth. So if we're designing cars or coming up with new medications, these are typically, still nowadays, designed by men for men. So the case that Caroline Criado Perez made was to move away from this and start collecting data about everyone, including minorities. And when it comes to medical research, she had a very good point that I thought would be good to share with our learners, which is about sex disaggregating our data. So basically, suppose you've collected data across a population to perhaps come up with to investigate whether a new medication is effective or not. What she suggested we do is also look at the subpopulation, so stratify based on gender to see if there's any differences, because perhaps the new medication doesn't work for everyone, but it might work just for women, or work much better for women than it would for men. So it's still effective for a part of the population. So yeah, I thought I'd share this with you, and I direct you to her book and other blog posts. She fairly recently gave an interview in a podcast called Freakonomics, which also is around, it's to do with data, which I think is a lot of fun and very educational. So yeah, if you're interested in finding out more about this, have a look around Caroline Criado Perez's contributions, and we welcome you to discuss this topic in the forums. Okay, I think this is everything.
Yes.
We'll look forward to catching up with you in the forums, and we're looking forward to your questions and comments and contributions. Thank you.
Thank you.
Bye.